Hello, this is Jung Lin. The topic of my video is scar revision on donor site without excision. Backhand image has the same important aesthetic quality as frontal image, since hair restoration is getting more acceptable to younger patients nowadays. Case report. A 40-year-old patient experienced 3 times hair transplantation, complained visible donor scar resulted from the first-time surgery. Past history of the patient. The donor scar from first twice harvest on the same area by simple suture resulted in 0.4 to 1 cm width. The donor scar is more imperceptible deforming from the third harvest by double layer suture with trichophytic closure. Obvious donor scar. Unanticipated tension vectors along the wound, vascular damage, post-op effluvium, unappropriated closure techniques. White scar revision. Donor scar wider than 1 cm. W-plasty scar revision. Direct excision if enough laxity. Tissue expansion with flap advancement. Hair grafting into the scar area may still lead to unacceptable result. Moderate scar revision. Donor scar smaller than 1 cm. Donor scar would be still unacceptable when it is more than 3 mm but less than 1 cm. Patient or self-perfectionist would ask for a scar revision. Moderate scar revision. Is there any procedure we could do for the moderate scar without damage to the vessels or hair follicles by the side? The donor scar ranges from 3 mm to 8 mm width. Our method. The patient has enough occipital laxity. We do scar removal by FUE device instead of scar excision. Without hair implant on the scar area to preserve results for the limiting donor hairs and avoidance of another new donor scar. The donor scar was performed skin retraction by 1 mm punches 166 holes and 0.75 mm punches 152 holes. 315 holes retraction were totally performed on the scar. Auxiliary techniques. Scar massage before revision. Dilute triamcinolone injection beside the scar after scar tissue removal. Mathematical distribution of the punch. If scar wider than 5 mm, 4 rows punches of 1 mm and 0.75 mm alternately on the scar. Mathematical distribution of the punch. If scar less than 5 mm, 3 rows punches of 1 mm and 0.75 mm alternately on the scar. Result. Post-revision in 1 month. Mild red and swollen immediately after scar revision. Mild particle sensation may be due to granulation tissue formation in the dermis. Result. Post-revision 3 months later. Particle sensation reduced after twice steroid injection. 1 to 2 mm width contraction of the scar. Average scar width 3 to 5 mm. Take-home message. There are some questions we should study more. How much diameter of the punch is appropriate? How many punches distribution would be better? Would it be worse if patient with severe keloid physique? Take-home message. By applying the extraction concept of FUE device, the author has performed skin extraction on donor scar. The advantage of using FUE extraction avoids the inconvenience and discomfort of physical cutting and stitching. The results will be investigated on more patients for customer satisfaction. Thank you so much for your listening.